side question for practical exam. Side question set 6. Side question number 1. In patient undergone post-op total hip arthroplasty, cemented posterior approach in maximum protection phase, weight bearing status non-weight bearing, and is fresh out of OR. In exercises to develop and improve muscle performance and functional control, explain the importance of bilateral UE and non-post-op LE training in the maximum protection phase. It is important for us to do the patient's bilateral UE and post-op leg, non-operated leg training to help the patient do ambulation or gait training with our assistive devices. It could help improve the muscle performance with the help of the upper extremity if ever we would use our assistive devices. And for the non-post-op leg, we could it helps to improve the patient's gait training. So if ever the patient would do a weight bearing with a non-operated leg, patient could do a standing position with the only one leg, which is the non-operated leg. Next is in side question number 2, in patient with volleyball with ACL reconstruction, you are to progress your patient into more task-specific intervention. What should be the assessed prior to the heavy activity interventions? So in preparation of the patient, of course, it is important for us to assess the vital signs and also test for the range of motion and MMT of the patient, just to be sure. Also, the cardiopulmonary of the patient and cardiopulmonary endurance of the patient. Next is side question number 3, in patient with PCL reconstruction undergone under prevention of re-injury, what is the specific activity and intervention should be introduced to the patient and why? So we could do leg press exercises. So leg press exercises, it could help increase the muscle strength of the patient, bilateral UE, and also could help the muscle contractility of the patient during gait or exercises or sport specific. So the next side question number 4, in patient who undergone artificial disc replacement of L3 to L4 1 week post-op, what other structure should be assessed and treated that may be affecting the patient's functional independence? So with this L3 and L4, we could assess the hip and knee. So in doing, we could do exercises on the lower extremity, be it be weighted or non-weighted assessment, and also sensory assessment with the lower extremity with the use of our exercises and modalities. Next is side question number 5, in patient who undergone spinal fusion following a 45-degree scoliosis that affected the patient's respiration, how could you improve the pulmonary endurance and functional ROM of the patient? So in pulmonary endurance and functional range of motion, we could do seated stationary bike, so the patient could simply sit and do the lower extremity and upper extremity exercises. There is a stationary bike wherein the upper extremity also moves, so we could use that. And also for the pulmonary endurance also includes, we could do a yoga with the patient, so the patient may do a yoga exercises with to increase the endurance of the patient's pulmonary endurance. So that is all.